If someone collapsed right in front of you today, at the supermarket, at work, in the gym, or even in your own home, would you know what to do? Not guess, not panic, not freeze, but actually step forward and help? Because the truth is, medical emergencies do not send warnings. They don't schedule themselves into our day. They interrupt ordinary moments without permission. 1 minute, everything is normal. And the next, a life is hanging in the balance. And in those first critical minutes, the person standing closest often becomes the difference between life and death. Today we are talking about something every adult should understand: what to do before the ambulance arrives. Not to frighten you, but to prepare you. Because preparation saves lives. Every year in the UK, tens of thousands of people experience what is known as an out-of-hospital cardiac arrest. That means their heart suddenly stops beating effectively. Not in a hospital, not surrounded by doctors, but in everyday places. Living rooms, restaurants, train platforms, parks, office buildings, often in front of family members, friends, colleagues, or even strangers. Now here is something many people don't realize. When the heart stops pumping blood, oxygen stops reaching the brain almost immediately. Within minutes, brain injury can begin. And without urgent action, survival becomes less and less likely. Not because help isn't coming. Ambulances are staffed by extraordinary professionals. But because time is the one thing the heart does not have. Which is why those first few minutes matter more than most people can imagine. Before we go any further, let's clear up one of the biggest misunderstandings. A heart attack and a cardiac arrest are not the same thing. A heart attack is a circulation problem. Blood flow to part of the heart becomes blocked. The person is usually conscious. They may complain of chest pain, tightness, nausea, or shortness of breath. A cardiac arrest is different. It is an electrical problem within the heart. The heart suddenly stops pumping blood effectively. The person collapses. They become unresponsive. Breathing may stop, or become abnormal. This is not a moment to wait and see. This is a moment to act. Because when cardiac arrest happens, every second counts. Here is something I want you to remember long after this video ends. For every minute that passes without CPR, survival chances can drop by up to 10%. Think about that. After just a few minutes, the odds begin to change dramatically. But here is the empowering part. When someone receives immediate CPR, their chances of survival can double, sometimes even triple. Which means your hands can literally buy someone time. Time for oxygen to reach the brain. Time for blood to circulate. Time for paramedics to arrive. In an emergency, timely action gives time back to the heart. So why don't more people step forward? It usually isn't because they don't care. It's because of fear. People worry they might do it wrong. They worry they might hurt the person. They worry they will panic. They assume someone else will know better. Let me gently reframe that for you. Doing something is almost always better than doing nothing. You are far more dangerous standing still than stepping forward. Emergency call handlers will guide you in real time. Defibrillators talk you through every step. Training builds confidence. You do not need to be perfect. You need to be willing. Now imagine this moment with me. Someone collapses. What do? First, take a quick look around and check for danger. Traffic, electrical hazards, anything that could put you at risk. You cannot help anyone if you become injured too. Next, check for a response. Call their name if you know it. Gently shake their shoulders. If there is no response, move immediately to checking their breathing. Look at their chest. Listen for breath sounds. Feel for air. Take no longer than 10 seconds. If they are not breathing normally, act immediately. Call emergency services. Put your phone on loudspeaker so your hands are free. Say clearly, "I am with someone who is not breathing." The operator will guide you through exactly what to do. You are not alone in that moment. Then begin chest compressions. Place the heel of one hand in the center of the chest. Place your other hand on top. Push hard, push fast, around 2 compressions per second. Yes, it is physical. Yes, it can be tiring. But what you are doing is manually pumping blood around the body. You are becoming the heartbeat until the heart can beat again. Continue until help arrives, or until the person begins to show signs of life. Now let's talk about one of the most powerful tools available to the public, the defibrillator, also known as an AED. You have probably walked past one without even noticing. They are in shopping centers, airports, schools, gyms, office buildings, community halls. These devices are extraordinary. Open one, switch it on, and it literally talks to you. Calmly, clearly, step by step. It tells you where to place the pads. It checks the heart rhythm, and it will only deliver a shock if it is needed. You cannot accidentally make things worse by using it, which is exactly why awareness matters. Next time you enter a public space, take a moment to notice where the nearest AED is. Familiarity removes hesitation, and hesitation is what steals precious time. But this conversation is about more than medical knowledge. It is about confidence, responsibility, community. Because cardiac arrest does not choose based on age, fitness, or background. It can happen to a parent, a partner, a colleague, a neighbor, a friend, or someone you have never met before. What many people also don't realize is that most cardiac arrests actually happen at home, which means the person most likely to save that life is already in the room. Imagine replacing panic with purpose. Imagine stepping forward instead of stepping back. That is what learning these skills gives you. Not just the ability to respond, but the courage to act. And courage can be learned. Cardiac arrest does not ask who is qualified. It asks who is willing. So learn the skill, take the training, have the conversation with your family. Because before the ambulance arrives, the life in front of you may depend on the action within you. If this message taught you something today, share it. You are not just passing along information. You could be placing life-saving knowledge into the hands of someone who may one day need it. Awareness saves lives. Preparedness saves lives. Action saves lives. And remember, before the ambulance arrives, what you do truly matters.